So she has she has qualified at Mumbai as a physiotherapist, has an experience of 40 years of encouraging women to exercise, musculoskeletal physiotherapist. She runs regular classes for fitness, has been awarded quite richly, Lifetime Achievement Award by Bangalore Physiotherapist Network, Women Achiever Award as well. And she has been the president for the local network and a consultant who is very, very busy. And that is the reason I am really grateful to her that she has taken time off today and she is with us. So here is Arti to tell us about post-surgery of a knee replacement or any other surgery which knee joints have undergone. What kind of exercises are required, for how long, and what should be the consistency and what results to expect. And she is a true expert in this, and I think there is immense gain from this. And as we spoke about helpline for Darshana, I feel even for fitness and for exercises like this, if Dr. Arti could enable for our IMS members, I request Dr. Pushpa Sethi whether an ongoing kind of thing can be there, at least for our members, if not for Club 35, at least for our members. So I'll be very grateful. So here is to you, Arti, and the floor is yours. Dr. Aarti Prasad.
Hi, morning, everyone. So
good morning.
Good morning. I like that response. I want that. And I thank Dr. Arti Gupta, Dr. Nirja, and Shobha Gudi especially, because Shobha has turned out to be a real support for every activity that I'm doing now for your
Dr. Pushpa Sethi, ma'am. Yeah.
Dr. Pushpa Sethi, thank you so much for inviting me again to talk about my favorite topic, that is exercise. And I think that is the most important topic that women generally tend to compromise on. They will just say it's okay, kal nahi karenge, aaj nahi karenge, to kal to zarur shuru karenge, par hota nahi hai aisa. But the most important is that we have to understand that exercise becomes an extremely important part of our daily life as we are tending towards menopause. So let's come to the topic for today, and that is knee replacement surgeries that we generally see now. Now, most of the women, it is generally, we see a large number of women who go into osteoarthritis. Basically, overweight is one of the biggest problems that we see. Diabetes and other comorbidities also add to the problem of osteoarthritis. And when the pain becomes unbearable and the ability to walk becomes very difficult, staircase climbing becomes very difficult, painful, knees swollen, the knees are getting distorted, and there is going to be some amount of deformities that are occurring, which you're unable to manage anymore, then the orthopedic surgeon advises you to go for a knee replacement. And when you go for a knee replacement, what do you expect? Remember that the surgery itself is going to be slightly painful, though, having said so, the doctors and the surgeons and the anesthetists now see to it that there are a lot of methodologies by which the medication has improved to such an extent that you don't feel much pain. And as physiotherapists, we can also help out in relieving the pain. How do we do that? We do that by giving something that is called as cryotherapy, that is compressed cold therapy, so that the swelling and the pain comes down. Expect a lot of swelling once the surgery is over in the knee joint. Do not fret about it. There is going to be swelling, and this swelling is going to gradually reduce over a period of time, and that might sometimes go into a couple of months. The swelling starts slowly abating as you start walking. Remember that. And the cryotherapy that we are going to be giving as physiotherapists is also going to help in reducing the swelling. So swelling is something that you're going to expect as soon as the surgery is there. Pain is another thing that you really have to understand, that there is going to be pain. but nothing to be worried about. The doctors now handle it beautifully, and the pain comes down and is within the limit. Now, the most important is the rehab part post-surgically, and that is where we come into the picture. Now, how do you do rehabilitation? We start on the second day. Most importantly, we look at the chest also. So we do some amount of chest physiotherapy, and we start with static quadriceps and exercises. So I am not going to talk so much. Let's get into the demonstration of the exercises that we are going to do. Now remember, all the exercises, the most important don't of a knee replacement surgery is that you will not be able to sit down on the floor anymore. You can do cross-leg sitting because there are I-flex joints that are available now. And these joints give you certain amount of freedom of movement by which you can do cross-leg sitting, but you cannot sit down. Sitting down becomes an absolute no-no. Very high energetic sports like playing tennis, like playing squash, all that to some extent will have to be curtailed. So you can go for short treks, you can go for walks, you can do staircase climbing, you can do cross-leg sitting. All these things can be done. This cross-leg sitting has to be done on a bed, on a high level thing. So these are some of the things that you will have to do. And as I said, the no-no is sitting down on the floor. So now I jump into the exercises because we are behind schedule today. So we're just going to start with the exercises. I have my mat ready here, and I'll just show you some exercises that you will start doing as soon as we finish the knee surgery. Okay, so we start off. So we start off with the knee exercises. As soon as the surgery is over, you will have swelling. And to reduce the swelling, the static quadriceps becomes extremely important. So you keep something below your knee joint, you roll up something, and just keep pressing. This is static quadriceps. This static quadriceps helps to reduce the edema. The other important thing that you're going to do is you're going to move your ankle up and down. This movement of the ankles up and down can be started as soon as the surgery is over and you gain consciousness. You start moving your ankles and doing a certain amount of static quadriceps. Remember, the static quadriceps can be done up to 100 contractions in a single day. The more number of quadriceps exercises you do, it is much better for you. So this, you will start the second post-op day. And the second post-op day, the physiotherapist will be visiting you. And when the physiotherapist visits you, what you're going to start with is, you're going to start with assisted straight leg raising. And that is lifting the leg up, up. You might not be able to lift this leg on your own. So you will be helped with by the physiotherapist, and you will be taking it up, up. That is the second exercise, third exercise. The next one that you're going to do is taking it to the side, side, side. Now you come to the most important exercise, because what is going to happen after a knee surgery is your knee is not going to move as easily as this because of the edema that is present there. Also, simultaneously, it is also because of the pain. So, and the apprehension towards pain is much more. This is what I have noticed in my practice, that people are scared of the amount of pain that they are going to get. So a lot of counseling should happen pre-surgically, and we do something that is called as prehabilitation. That means we teach the patient the exercises before the surgery. The same exercises are repeated by the patient a couple of times, at least 1 week to 10 days before surgery. Believe me, the post of rehabilitation becomes very smooth sailing once they understand that these are the exercises that they have got to do as soon as the surgery is over. So coming back, we are going to do some amount of knee mobilization. So we start the knee mobilization extremely slowly, extremely slowly. Now, this routine continues for the first few days, and as soon as the sutures are removed, then you start doing prone lying exercises. So I will just show you a couple of exercises in a prone lying position. So we are going to be lying down on our stomach, and we take the leg up, 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 and bend the knee, bend the knee, bend the knee, and bend it. These exercises are done as soon as the sutures are removed. And we add on some more exercises for the abductors. The abductors need to be strengthened because otherwise you'll have a trembling bone gait. So there is going to be a dipping of the pelvis if your abductors are not strong enough. So we start putting them in a sideline position, and you put them in a sideline position. You take it up, 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 and up. Now, these are the bed exercises that you're going to do initially. As improve in between the first week itself, you start making them sit at the edge of the bed, and you start making them do the quadriceps exercises. So it is going to be make the patient sit straight at the edge of the bed. You might not be able to move the knee completely, so it is going to be a very mild movement of the knee initially, which slowly they will come down to be made to sit comfortably at 90 degrees of flexion. They start becoming very comfortable in this position. Once they are comfortable in this position, it is time to teach them how to sit on a potty chair. So once they are able to do that, we start on the third day of knee replacement. We start annulating them with the help of rope. They might be initially able to do only about 3 to 4 steps, and slowly you increase the number of steps. And once you achieve this 90 degrees of flexion, then you start making them sit on a potty chair, and slowly they will be able to sit on a potty chair and get comfortable. So their toilet activities or the activities of daily living are taken care of. Once this is done and the patient becomes very good, very strong with their quadriceps muscle power, now that is your measurement. They have to be able to do independent straight leg raising, and they should be able to do sideline independent abductors. So also at the edge of the bed, they are able to do the knee range completely. As a physiotherapist, I will also look at whether the person has a certain amount of quadriceps weakness at the last range, so that there should be no lag that is occurring. And one of the complications that we as physiotherapists see is the person can go into a fixed flexion deformity. So hamstring stretches becomes one of the most important exercise during the rehabilitation of a post-op knee replacement. So once we take care of all this, we convert them into doing the same exercises with weights on. Have these weights, these are ankle weights which can be tied around the ankle, and this can be given as resisted exercises to the patient. And once we do that, I'm tying it around the ankle, and I'll show you those exercises also which we would do with weights on. So these are the weights that have been tied onto my ankle now. So with support initially, you start making them do the standing exercises. So you do the flexors of the hip, and then you do the abductors of the hip, and then you do the knee bending so that the iliopsoas and the psoas, iliacus and the psoas come into strong play. So do this also. And then the most important muscle, the gluteal muscles, they are also taken care of. And then the knee flexors. And this routine will continue for a couple of weeks. The most important advice to post rehab is that they will have to continue the exercises at least for about 2 months, and not that they need to stop after this, after they get better. Start going for walks once you're very comfortable with your knee joint. There is going to be a little swelling, nothing to be worried about. That will slowly come down as time passes by. Pain is going to be there initially, and that will also get accommodated completely. Muscle power is one thing that a patient needs to build. Staircase climbing can be started as soon as your knee range and your muscle power is good. It might be any time around 2 weeks to 3 weeks. And exercises need to be continued for some time in all these kind of rehabilitation for these patients. Okay, so I end my demonstration here.
Dr. Aarti,
Haji,
I will like to ask you, after having the knee surgery, what exercises a person can do after 3 months or 6 months? Follow up. How only walking or other exercises the patient can do, or which exercises patient can do?
yeah. So the most important that they need to avoid is any kind of twisting movements, too much of twisting movements on your knee joint. That is going to cause little problems. They can do very regulated kind of aerobic activities. They can go for swims. Swimming is a very good idea. They can go for even good long walks that they can do. So these are some of the activities that they can continue after 3 to 6 months. As I said, only avoid sitting down on the floor. Good walks, going for short hikes, no problem, absolutely. Swimming, excellent. Some form of aerobic exercise they can do, which is very good for them. But do not, as I say, why I said no to too much of strenuous contact sports is basically there is going to be a certain amount of twisting and turning movements. That is the only thing that they have to really take care of.
What about the gym exercises and weight bearing exercises?
Absolutely, they can do it. They can do even body weight exercises. Absolutely no problem. Gym, go to the gym, do the cycling, do the elliptical. All this is an absolute yes, yes.
And the legs से जो weight bearing exercises होती हैं?
Sorry?
Weight bearing exercises with the legs.
Yeah, they can do. Absolutely, you can. Yes, absolutely.
Is there any limitation of the weight? Is there any limitation of weight?
It all depends on the kind of muscle that they have proven. Now, they, to some extent, at least 80% of the pre-op weight that they can go back to. Suppose they have been lifting 10 weights of 10 kgs of weight, they can go up to even to 8 to 9. There's absolutely no problem in doing that. The most important advice I would give is, remember, do not stop exercising just because your knee replacement has become successful. I have had my mother who had a knee replacement done at the age of 80, and she was absolutely fine till 90 years. She did her exercises every day in the morning without fail. So please continue your normal activity, only sitting down. Too much of contact sports, no, but swimming, weight-bearing exercises, going for long walks, going for hikes, going to the gym, absolutely can be done.
See, Arti, I think what Dr. Aarti Gupta is trying to ask you is, normally, you know, how much weight we allow a woman to bear, a postmenopausal woman, 1 kg or 2 kg sandbags on each side or weights on each side. वो चाहिए था कि earlier whatever they were able to tolerate well, do they continue the same or they have to reduce, something like that.
This muscle is going to take time to build up. Remember that.
Okay.
Post-operatively, it always takes time to build up. And there are a lot of mental factors also which go into this whole picture. People are scared, what will happen to my knee joint if I do something like this, if I do another thing. So you can improve, you can take a certain amount of weight. We always start with about 1 kg, or if the person is not able to bear the weight, we start with half kg. And we start with 1 kg and we ask them to progress. So progression can go up to 3 to 4 kgs easily. No problem. Absolutely no problem. But
each way, for each knee, na? For each knee.
For each knee. But but remember one thing, having said so, it all depends on the amount of power that that person individually has. It's a very individualized thing again, you know. If that person has a good muscle power and has been an athlete or a gym goer or this, they will always fight back and try to go back to the normal.
Okay, okay.
They start with small weights, progresses to whatever level the muscle can take.
So it should be under supervision. That is the whole question, because you know your consults are your consults are not cheap. Sourcing a physiotherapist can be expensive for patients. So
I'm very impressed with this, Shobha. I'm absolutely impressed and happy for my profession.
No, you should be happy because it is well-deserved expense on your part. And of course, it is something that we have to do on our part. But what I'm trying to ask is for how long it should be under supervision, like post-replacement?
So as soon as, yes, that's a very good question, a valid question. Now, initially, we ask the therapist to go home and take care of the patient for at least 3 to 4 weeks until they really see. The most important is the gait, how they walk. Do they still walk, continue to walk with a walker, or do they become independent? More important. So the independence, staircase climbing, all the activities have to be perfected, which generally gets done by 4 weeks. After that, the supervision can be withdrawn and there are follow-up visits. They start coming to the clinic or the nursing home or to the department. They keep coming and we keep following up for 1 week or 10 days. So things go like that again. So supervision need not be, and for after 4 weeks, slowly the physiotherapist withdraws because the dependency on the physiotherapist tends to become a little more. We don't want that.
Thank you, Dr. Arti. Shobha ji, conclude the talk. Dr. Shobha. I think this is a very, very, very important session, and I want to listen this for long because I have my total knee replacement, and I want to.
Wonderful.
And I want to know what are the, because there are so many things. Some persons are saying you do this. Doctors are saying do not go to the physiotherapist, don't do the physiotherapy exercises. So there's a lot many confusion in my mind. That's why I want to ask you, because I am doing the weight bearing exercises and the doctors are saying you should not do very much of the weight bearing exercise. In my mind is this, I should build my muscles so that I am doing the weight bearing exercises. That's why I've asked you how much weight I can wear when we are doing the exercises.
See, remember one thing, we cannot stop. Always, as a woman menopauses, what I have seen is the change in the muscle, which is, we see it very often. And we do not want the muscle to become flabby. So you can start doing weight-bearing exercises. Maybe do not push your knee too much. It all depends on you. Being an intelligent person, you will be able to understand to what extent you will be able to go. As I keep repeating, turning, twisting movements, avoid as much as possible. Swimming, I would really recommend swimming because it not only gives you a muscle strengthening program, but it is a very good aerobic exercise for you. So I would really recommend that. Please do weight bearing exercises. Please take resisted exercises. And Go up to 3 kgs, 4 kgs easily. It should not be a problem. As I again want, it all depends on your individual muscle power. Get analyzed. We have equipment to measure the muscle power now. We have equipment. So go to a physiotherapist, get that evaluated, and then you will be able to understand to what extent is the weight that you can take, the resistance. But please do not stop exercising. I think I love you for saying this, Dr. Arti. Really wonderful, wonderful to know that people want to be that fit.